Good day, everyone. My name is Anjulia J. Gutierrez, and I'm from Section D. I'll be reporting on part two of Module 7. So, for this, we'll be focusing on monitoring and evaluation for social and behavioral change communication with insights from Seoul City and the Philippine context. So my main resource for this is by Weiner, the monitoring and evaluation for social and behavioral change communication at Seoul City. So first of all, what is behavioral change communication? So behavioral change communication, or BCC, is all about using media and communication strategies to shift people's behaviors and social norms. So when we think about this, we think about um, shifting people's behaviors to better their their health, safety, and well-being. So, what's Soul City? So, in Africa, Soul City is like a movement or an organization that uses TV, radio, and print to spread messages such as HIV prevention. And in the Philippine context, similar to the DOH's HIV and AIDS campaign, they use media to educate and shift attitudes about HIV or AIDS in the Philippines. So here are some photos from the Seoul City Institute Health and Development Communication. So as you can see, they have their old logos, their old ads, as well as new more recent advertisements about condom usage and HIV prevention. So, with this said, let's get into the social learning theory. So, the key idea of the social learning theory is that people change when they see others doing it and getting positive results. And you're more likely to adopt a behavior if you believe that you can succeed at it. So with Soul City, they had a 13-part series about HIV awareness. And because of that, the thought behind that is that TV dramas show risky behaviors and their consequences. So the 13-part series were showing real life scenarios and real life risky behaviors that people can fall into, and it shows the consequences of lifestyle certain lifestyles, and the viewers can see the impact, and they can possibly relate, which can prompt a certain change in their real life. And in the Philippine context, in the family planning campaigns around the Philippines, they use media as as a sort of role model to influence people, just like Soul City does. So, since in the Philippines we are dealing with overpopulation and poor family planning, um, people and organizations need to get more creative to influence people to practice family planning. So this is a brief summary of learning about the social learning theory. So first, people can learn through observing others, and but it's not enough to learn through observation alone, because your own mental state and your beliefs, your inherent beliefs, are also contribute factors to your learning, and it's important to how you accept new information and learn from them. So because of that, learning does not necessarily lead to behavior change, because even if you um, for example, even if you try to educate someone who tends to fall victim to misinformation and fake news, it's difficult to change their behaviors and their outlooks if it's inherently ingrained in them that what they believe in is the absolute gospel truth. So I think we can relate to that here in the Philippines. So let's talk about Seoul City's social behavior model. So how Seoul City works is they use TV, radio dramas, social mobilization, which is community discussions, and advocacy, which is health messages for policy change. And I like to add that Seoul City also does surveys around villages to get more insights on how the people think about healthcare and HIV/AIDS. So these are screen caps from the 13-part series that they put out about HIV and AIDS. And yeah, it's supposed to be based on real life and showing, educating the viewers. So let's talk about the M&E framework, or the input process output outcome impact. So this is how we can measure success in when it comes to movements like the Soul City. So we can input resources such as money and materials, such as to make radio dramas and campaign materials. So the process is activities like media creation and outreach, which is the production of awareness campaigns, and the output is immediate results, like how many might have watched the TV show, the 13 part series of Soul City, or how many people has viewed a certain TVC or awareness advertisement. And the outcome would be measured by, did people's knowledge or behaviors change, or did it stay the same? And the impact here is, did the behavior change lead to long-term health improvements? So it's not enough that someone's behavior has changed. We also need to measure the long-term improvements or the long-term effects of this new behavior that they adopted. So here's a quick summary of it. So we have their goals, objectives, the activities, inputs, and the outputs, which is mostly the focus of monitoring. And the outcomes and impacts is the focus of evaluation. So what do we measure in monitoring and evaluation? So the key indicators here is, how many people saw the media campaign, and did people learn or change their behaviors? For example, do people use condoms now? Do they purchase it, or do they use it more often now? And did the intervention reduce the disease or the issue? As in, did HIV rates go down? Did the spread slow down or stop completely? So that's the impact. So the outcome is the changed behavior. The output is the, um, if they've seen the media campaigns and such. Uh, Philippines, in the context of the Philippines, in family planning campaigns, the key indicators include how many women have started using contraception after watching the campaign. So this term for this contraception doesn't just mean condoms, but do they use birth control? Do they use injectables? Do they use IUDs now? So that's an example that is often seen here. So let's talk about the quantitative versus the qualitative approaches. So for quantitative, we have cross-sectional, which is comparing exposed versus non-exposed groups. Cohort, which is tracking the same group over time. The pre-post or quasi-experimental, which is measuring before and after. In the Philippine context, in anti-smoking campaigns, surveys track smoking rates before and after being exposed to media that's about anti-smoking. For qualitative, this doesn't measure by numbers. They use focus groups and interviews, like talking to people for deeper insights. In the Philippines, this could mean focus group discussions with women to help them understand how they perceive family planning messages. So here's some photos of such family planning counselings and seminars around the Philippines um, for low income and for low income families and women. So, what are the challenges in monitoring and evaluation? So, for multi-level data, collecting data from different levels, like the individual level, the community level, or the society level, can be tough. So the challenge in the Philippines, for example, is in rural areas, it's harder to track how many people actually saw a media campaign due to limited access to TV or internet. And the changing indicators for this is new interventions need new ways to measure success. So in the Philippines, new health campaigns like mosquito repellent initiatives needs fresh M&E strategies, because even though dengue has been a problem for years now, it's still on the rise, and communities, especially barangay in the barangay level, they needs fresh strategies to combat the spread of mosquitoes and dengue. Another challenge is feedback and reach. So, getting accurate feedback on media reach is difficult in remote areas. So, for example, in the Philippines, radio dramas might work better in rural areas than TV campaigns due to signal issues. So here, like I said, we need to continuously improve our country's initiatives regarding dengue and family planning. So for the case of Soul City's M&E uses media, community engagement, and advocacy to measure knowledge, attitudes, and behavior changes. So, Soul City tracks changes in HIV knowledge and condom usage through surveys, like I said, and interviews for the people around different villages and communities. In the Philippines, similar methods are used in Philippine HIV prevention programs. So media campaigns ensure measure behavior change using surveys and interviews, and even counseling. So this is just a model on the Soul City M&E. So you can feel free to pause and read this in depth. And here, like I said, the example for HIV awareness campaigns in the Philippines, there's lectures, counselings, and help from NGOs and the government. So, in conclusion, the social learning theory is crucial in understanding how people change their behaviors through media exposure and having role models around them. So, the input process output outcome impact, or IPOOI framework, offers a systematic approach for evaluating BCC programs, whether in Africa or the Philippines. And the quantitative and qualitative methods both provide essential data for understanding the success of public health campaigns. And as for the challenges in M&E in BCC requires flexibility to adapt to new challenges, especially in diverse cultural and geographical contexts, like in the Philippines. We have different different minority groups, different communities, different cultures based on regions. So again, my main resource for this report is Wayner's Monitoring and Evaluation for Social Behavior and Change Communication in Seoul City. You can check out the full PDF of this on Google. Thank you.